Administering rectal suppositories. The purpose of administering rectal suppositories include the following: to provide temporary relief of clients who cannot tolerate oral preparations, to induce defecation, to relieve pain and local irritation, to treat fever, and to stimulate peristalsis and defecation in clients who are constipated. Equipment needed are gloves, suppository, lubricant, tissue paper, bedpan, and dry sheet. The first step is to review doctor's order, including client's name, medication name, form, route, and time of administration. This ensures safe and correct administration of medications. And then, review medical record for rectal surgery or bleeding, because these conditions contraindicate the use of suppository. Wash hands to reduce transfer of microorganisms, and apply disposable dry sheet to prevent contact with infected fecal material. It is important to identify client and check identification bracelet. This ensures the correct client receives the medication, and we should not forget to ask the patient to state name. Explain the procedure to the patient and be specific if the patient wishes to self-administer the medication. This promotes understanding and cooperation and will enable client to self-administer medication if physically able.
Maayong buntag, ma'am. Balik ko mamunta na sa tibok ng pangalan. So, Miss Evan, karong buntag, maghatag og tambal nimo. So, ma'am, tungod kay hapit usa ka semana naman ka nga wala ka paggawa sa imong huga, wala ka kalibang, nag-order ang doktor na hatagan ka og suppository para ma-stimulate ang paggawa sa imong hugaw. Okay ra ba kung ako'y mo butang sa suppository, ma'am, or ganun kung ikaw lang? Okay ra ako. Sige. Magandam lang ko, then balikan lang ikaw.
Arrange supplies at bedside to ensure smooth procedure. Close room curtain or door to maintain the client's privacy and to minimize embarrassment. Assist client in assuming Sims position. Keep client draped with only anal or the anal area exposed. Proper positioning exposes the anus and helps the client relax external anal sphincter, and draping the client appropriately maintains privacy and facilitates relaxation.
Isang kanyang kortina, ma'am. So, ayun lang ka, kuya, ma'am, ha, kay dili naman yung sakit. Para po, mas dali na itong ma-insert ang suppository. Kaya kung kuyawan ka, dili relax imong muscles, madugay na itong insert ang suppository. Dali rin noon ni ma'am. Sige, ma'am, ha. Palihog lang ko og Karang dinda ma'am. Dayon, kuan imong sampot. Isa ka. Sige, butay mo sampot ma'am. Okay. Tagilid lang dito sa wala ni mo ma'am. Dayon, kaning imong kuan ma'am, imong isang paa kay nas ibabaw, i-flex ni padulong dito na jutay. Dayon, straight training sa ubos.
We should examine the condition of the anus externally and palpate rectal walls as needed. If gloves become soiled, dispose them by turning them inside out and placing them in proper receptacle. The examination determines presence of active rectal bleeding, and the palpation determines whether the rectum is filled with feces, which may interfere with suppository placement. The proper disposal of soiled gloves reduces the transmission of infection. Apply disposable gloves if previous gloves were discarded to minimize contact with fecal materials and reduce transmission of microorganisms. And remove suppository from wrapper and lubricate rounded end. Lubricate index finger of dominant hand with a water-soluble lubricant. Lubrication reduces friction as suppository enters the rectal canal. Or prior to inserting the suppository, ask the client to take slow, deep breaths through mouth and relax anal sphincter. The rationale for this is that forcing suppository through constricted sphincter causes pain that would be very uncomfortable for the patient. Upon inserting the suppository, retract buttocks with non-dominant hand. Insert suppository gently through anus past internal sphincter and against the rectal wall. That's gonna be 10 centimeters or 4 inches in adults, 5 centimeters or 2 inches in children and infants. And there may be a need to apply a gentle pressure to hold buttocks together momentarily. The rationale of placing the suppository past the internal sphincter and against the rectal wall is for eventual absorption and therapeutic action. After insertion, withdraw finger and wipe anal area with tissue to provide patients comfort. Discard gloves by turning them inside out and dispose of them in appropriate receptacle. This reduces transfer of microorganisms. After that, ask client to remain flat on or sideline position for 5 minutes to prevent expulsion of suppository. If suppository contains a laxative or stool softener, assist client as soon as possible as he or she has the sensation to defecate to provide client with sense of control over elimination. This will also allow client to obtain assistance to bedpan or toilet. Return within 5 minutes to determine whether suppository was expelled because reinsertion may be necessary if so. Observe for effects of suppository 30 minutes after administration, such as bowel movements and relief of nausea. This evaluates effectiveness of medication and relief of client's symptoms.
Mahingon lang nako og gamay ang habol ma'am ha kay mag-insert nako sa tambal. Kaning suppository ma'am, ingon ni siya og chalk og forma pero mas gamay o mas niwang. Gayon, basa-basa pa ni siya og danog-dandog, pero gamitan na gyapon ako og KY jelly para mas madali pa gid natong ma-insert. Hasta ang akong tudlo, butangan pa na ako og KY jelly. So ma'am, ginhawa lang pinaagi sa imong baba ma'am ha, then i-relax ra imong lubot. Ha? Sige, relax lang, ginhawa sa baba. Sige ma'am. Ikipot imong kuan ma'am, sampot ma'am. Ako sa idot ug karyot ma'am ha, para makakuan mayo ang tambal. Sige ma'am, ihigda ma'am. So ma'am, higda lang og flat in 5 minutes ha. Dahil balikan usap ikaw after 5 minutes at yung nagtawon ko na-absorb pa maayo ang tambal o nikuwas og balik. So within 15 minutes, mga 15 minutes or 15 minutos ang tulo sa kauras, dapat makapagawas na ka sa inyong lugaw.
Recording and reporting should follow after. Record administration of medication on patient's chart. Place initials or signature on medication sheets opposite to the time it was administered, and record client's response in nurse's notes. Also report any unusual systemic effects to nurse in charge or physician.